Green morning, green afternoon, green evening to all our brothers and sisters across the globe. People, those are joining us from the different continents, in the different countries, in the different time zones. We extend you a very warm welcome. It's indeed a great pleasure to have all of you. Thank you very much for sparing your most valuable time, because it's a deep concern for the humanity. It's a deep concern for entire Manav Jati. And today's topic is so relevant to today's times, today's progeny, today's civilization, today's humanity, our lifestyle, our food, and whatsoever we think, we talk, we walk, and we eat, everything is so important. So, ladies and gentlemen, green morning to everybody in Canada, Latin America, and United States. And green afternoon to all my brothers and sisters in UK, as well as in the entire European Union people, those are joining us over there. Early evening for my brothers and sisters, those are joining us from Central Asia, Middle East, and a couple of other places. And little late evening for my president all the way in Thailand. And of course, my brothers and sisters, those are joining us from the 10 ASEAN countries. We extend a very warm welcome. And let me come to my beautiful Bharat, such a wonderful country, such a wonderful civilization. And we have got eminent, distinguished, respectable, dedicated, devoted people like Dr. RAVUL JINDAL. He has just come out of the operation theater to be with us for a short while and to share his vision and to tell us how to basically take care of our, diabetes prevention. We have to take care of ourselves, because it's very alarming to hear that India soon is becoming diabetic capital of the world. So particularly today, he's going to focus on diabetic foot and its prevention. Dr. RAVUL JINDAL ji is the eminent director, vascular and endovascular surgery at the prestigious Fortis Hospital, Mohali, Punjab in India. We extend him a very warm welcome. Thank you very much, Dr. Saab, out of your most busy schedule to spare a time for the humanity and to be with us. All the 31.4 million, my brothers and sisters, Indian diaspora, 149 countries, we extend a very warm welcome to all of you wherever you are. And during this pandemic, we had lots of challenges, but hats off to these doctors. They are the great warriors. They are not less than any other soldier in the white uniform. Those are protecting, soldiers are protecting borders, but they are protecting human lives and every soul on this planet. During this pandemic, we have been focusing on, because 1.65 billion children, they were away from schools and colleges and institutions. So we were basically supporting the entire education ecosystem. Now, ladies and gentlemen, this is not so sweet. This is a little alarming. Dr. will give the complete details, but what we could learn after China, India, and now soon we would be taking, it is not a respectable #1 position in the world. Let's save every soul. So your health, your wellness, everything is more important. And B2B now back to basics, basic food, basic health, basic happiness, basic wellness, taking care of yourself, and of course, digital education, e-learning, earn and learn when we talk about. So I come to my final slide before I take you to very respectable hands of Dr. RAVUL JINDAL ji. Let's come together, because whatever human mind can conceive and believe, it can achieve. That is what our chamber thinks. Let's make entire thing in this universe very meaningful, and all of us, we should live peacefully. Join me in extending a very warm welcome this morning, this afternoon, this evening, all the way. And we have got our distinguished guest, Dr. RAVUL JINDAL ji. Hearty welcome. Pleasure to have you with us, Dr. Saab. It's indeed a great, great pleasure. And diabetes, that's becoming very serious. India is moving in a very alarming situation. Please educate us, empower us, give us the roadmap. How do we save ourselves? How do we save every soul? How do we save every person? Because lots of people are suffering world over, and we do not want India should become the capital of diabetes. With these words, ladies and gentlemen, a warm and a very hearty welcome from the bottom of my heart to Dr. RAVUL JINDAL ji.
Thank you, Ji. Thank you for the nice words, and I welcome all my friends from all across the world. 14th November was World Diabetic Day, and it's a very appropriate time to discuss this and medically. And I'm just going to go through you different slides. Where we are, and so we must open our eyes to where we are reaching. Now, this is a September 2021 data, and by the International Federation of Diabetes and the WHO. And you can see in India, I'm going to concentrate here, we have got approximately 82 million diabetics in 2017. And the projected is that by 2045, we'll have an 84% rise in the number of diabetics, and it's going to be 151 million. Now, this is very important because if you compare the developed world, let's say, let's look into the America, and let's look into the Canada, let's look into the Europe. If you look into this, the increase in the number of diabetics is very important. And if you look into the developed world, get increased only by 35%, as compared to poorer countries like Africa, where the number of diabetes are going to increase by 156%. So what we have seen is from this chart is that the number of diabetics in the next 30 years are directly proportional to the developed world or the underdeveloped world. The reason for that is because if you look into the prevalence of people with the diabetes also, the high income group people, they get more diabetes as compared to the people who are poorer or in the lower income countries. So then how come the Africa is going to get a huge number of diabetics and less number increase in the developed world? It is because of the expenditure on the diabetes. If you look into the left side, the China, these are the top 10 countries who has got the number of diabetics, and if you look into the China, they have got the largest number of diabetics, but in India, we will cross them soon. But look into the health expenditure. The health expenditure is by the red line. Now look into the India, we've got huge number of blue line, but look into the health expenditure. So we are spending the amount of money we spend on our health is equivalent to Indonesia. But you look into the population, what we have on the diabetes. So that's why if you look into the United States of America, the third one, look into the health expenditure, the red line. The amount of money what they're spending on the diabetes is huge. So basically, it's not the developed world or developing, it's the amount of money which is spent on the national diabetic programs about educating the public. And education is the main strategy in this decrease in the number of diabetics which we are going to have. Now, this is something called a National Diabetic Program. And look into the dark blue is the implemented NDPs. And look into India. So we still don't have any National Diabetic Program at all. So let's say if we start having the program now, we are going to see the results in 20 years. So that's the thing. So you see, if you look into the America, even if you look into the Canada, the NDPT is not implemented. So it's only that the program needs to be made and then implemented in the country. And then you will start seeing it, because it requires a whole generation. So 20 to 25 years of time before we start decreasing the number of diabetics in our country. So unless the government starts now, it's going to take a huge amount of time before we get there. Now this year, the main motto of the World Diabetic Day is an access to diabetic care. So people feel that every diabetic should have an access to diabetic care. If we are not going to have a access in 2021, then when we are going to have the access. So in diabetes, you get a neuropathy, means your nerves in the foot goes off, then you get an ulcers, and then you get an amputation. So most of the amputation means cutting the limb. It's a very, very bad thing which could happen to a patient. And all that thing can be prevented just by an education. So that's the importance of this lecture. You must understand every 10 seconds, one person dies of diabetes in the world. Every 10 seconds, 2 people will develop diabetes in the world. And each year, 7 million people develop diabetes. So it's a huge number. So we started our diabetic foot clinic in 2006. It's like nearly 15 years back, and trying to educate public. There are a lot of myths which are associated with diabetes, that diabetes only causes heart disease. So it's not true. So you have to understand that diabetic affects all the blood vessels in our body. So starting from the head, it will cause you strokes. Then it can affect your eyes, blood vessels, causing you diabetic retinopathy. Then it will affect your blood vessels in the arms, in the heart, causing you heart attack. It will affect your kidneys vessels, causing you kidney failure, and then along with a peripheral arterial disease, what we call gangrene. So 10% of the patients with diabetics will develop retinopathy, kidney eye problems. So that's why every diabetic should have their eye checkup every 6 months. There is a huge percentage which will develop a kidney failure. So that's why these patients should have every 6 monthly kidney checkups. 50% of the patients will have a heart disease. So they must get their heart checkup every 6 months. They will also develop a signs of neuropathy. Normally, once you have the diabetes, post 10 years. So neuropathy means they will have different feelings, like a feeling of cold in the foot, burning, knife sensations. Some people will complain that there are ants crawling in their feet. All these are signs of neuropathy. Then the myths too is that diabetes rarely cause foot problems. That's why there are not many lectures or discussions in the public fora. You have to understand 20% of all diabetics will have a foot ulceration. And recent studies have shown one of the major causes of death with diabetes is a diabetic foot. And once you have a diabetic foot, there is a huge amount of chance that you will get an amputation. And once you have a 1 foot amputated, there is a huge chance, more than 50%, that you will have the second leg amputated in the next 2 years. So it's a huge problem and huge economic burden on the family, or society, and the country overall. So if you look into the number of diabetic what we have in our country, in India, and if you look into even 10% of the diabetics gets affected out of 90 million people, means around 10 million people with diabetic foot. So you can't imagine, we can't handle it, because there are not even 1,000 doctors in the whole country who can manage the diabetic foot. So imagine a number of people, 1 million people getting a diabetic foot. 1 million is equal to 10 lakh people, 100,000, and served by 1,000 to 2,000 people. So it's not possible to prevent an amputation in our country. So that's why we must prevent it. So that's what we are going to go to. So first we see how these patients you see in your practice, how the patient comes to us. So look into the badness, gangrene in the foot here, diabetic foot. Look into the other one. Some people will get a claw toes. So their muscles get paralyzed and they get this curved toes by which this foot will hit in the ground when they walk. Some people will get this infection in the foot. The foot will be very dry and you will have a very dry skin. Then you get a callus. This is all because of neuropathy, because the toe is hitting the shoe again and again, and the patient does not feel any pain at all. And so you get a callus formation. Then you get interdigital callus in between the toes. And these are the various different types of diabetic foot, where the rat has eaten the toes because they cannot feel. The ants have eaten the toes. The person has walked into the temple barefoot, and because of the hot marble, they got the burn in the foot, but because they don't feel the pain. So having a pain in the foot is a protective sensation given by the God. Then because of muscle paralysis, you get a deformity in the foot. Then you get a callus like this, and you get a Charcot's foot. Your multiple fractures happens into the foot, by which the whole foot is deformed and you get a multiple ulcers. Now, this is very good example. One of the patient who came to us in 2007 with a small area of gangrene. Can you see a small infection in the toe? Now, if he would have agreed to get treated on the first day, we could have improved the blood supply and given him some antibiotics. We could have saved the whole toe. But this patient did not came for the treatment. He went off. He came after 3 days. He got the gangrene. Then he came after a week. He got the first and the second toe gangrene. And then he came after 14 days. So all 4 toes have gone. So see, at this point, he agreed to us that, okay, now doc, you can improve the blood supply. So, it's a delay in the treatment, 2 weeks. And so what we had to do is we had to cut half of the foot here, improve the blood supply. But if we would not have done the treatment at this point, he would had a leg cut up just below the knee. So that's a major amputation. And only 50 to 60% of these patients will be able to walk after the major amputation. But let's see this another example. He got a non-healing wound on the ankle, as you can see on the heel. And there was a blockage in the artery. So once we opened the blockage in the artery, this patient agreed to get treatment at the right time, though he had come late, but still. And once you improve the blood flow, control the infection, you could save this foot fully. So that's the importance. Another few examples. Look into the extensive diabetic foot. So this happened only within 48 hours. So infection in diabetic foot can spread very fast. So you need to do and treatment in an urgent way. So you should not wait at home for 2 or 3 days or 4 days. And within 48 hours, you can actually be in the ICU in diabetic foot. So this patient underwent a debridement of the infection, extensive debridements, some disturbing pictures you will see, but it's very important to show you this picture because we see these patients, you can imagine, every day. And then these wounds, they heal up and we put in a skin graft and then this foot can be saved. Similarly, another patient with a gangrene of the toe with a spread of the infection to the whole foot. And once we improve the blood supply, we clean the wound, clean the foot. We did put in a lot of antibiotics, a vac pump, and then ultimately these wounds, they slowly and slowly they heal up and patient gets saved with 1 toe and half of the whole of the foot and could walk on this foot, which is very important. Another very delayed presentation of a patient with a gangrene, the whole toes are black, and this patient was advised below knee amputation, so very major amputation. So as you can see, there was no blood supply in the foot, and so we improved the blood supply into the foot. The black color things is all arteries, you can see. And once you improve the blood supply, we did the debridement and cleaned the foot, and you can save this foot also. Another example, with the toe and the gangrene here. So this is the dead tissue on both the sides. Very poor blood supply. Once you improve the blood supply, these wounds, they slowly heal up. You can see here, and we can save this foot of these patients. I think this is the last example with very bad toes. You can see this patient came from Canada and was advised that nothing can be done on this patient. We did a debridement, opened the arteries up extensively, did a massive debridement, and we could save this foot, and the wound healed up very nicely, as you can see in this photograph. So the main thing is that prevention is better than cure. So now I'm coming to the main point, and after scaring you with very bad pictures, is that early treatment is very important to avoid complications. And we need to create public groups and public awareness programs. And if we really need to save the patients from this. Diabetic related deaths will increase by nearly 50% in the next 10 years, the way it is going. And if you look into the school, the childhood obesity is going up and up very rapidly. So how can I reduce the risk is control the diabetes, control blood pressure, don't smoke, don't drink, and eat a healthy diet, which is full of fruits and vegetables and whole grains, and must exercise daily. Now, this is a very, very important slide because it's so easy to write it down, but it is so difficult to implement in day-to-day life. Because people ask us, how can I prevent diabetes? मेरे को diabetes हो ना. You see, the diabetes is a genetic thing. If your parents has diabetes, that you got a very high chance that you will get diabetes, but you can delay it, and in some people you can actually prevent it. So this can only happen if you don't gain weight, don't eat too much of sugary, and eat fruits and vegetables, and have a method of exercising daily. So feet are very precious. We must preserve and protect them. It's very easy to cut, a leg. Coming to the prevention. Now, these are the very important slides. Now, diabetes get a dryness in the skin. So the foot should not be dry. Always try to do a moisturizing lotion. Every day, you should have a mirror and you should check below the feet so that you don't have any wound there. Because if you have a 10 years old diabetes, you will get a neuropathy. Even if you have a wound in the foot, you will not come to know. So we tell them that before you sleep, just check up with your mirror that your feet are absolutely fine below it. Then you get cons like this. Please don't do anything. Don't apply tapes and all, which is not good. Do you know why these people develop cons? Because they cannot feel the pain in the foot. And so what you need to do is just a bit of cleaning from the podiatrist and change your footwear. So you need to change the footwear, go to the podiatrist, don't do anything yourself on this. So we clean it up just like this, we change the footwear, and these cons after 2 to 3 months will disappear themselves. These cons are the prerequisite when you get infection and you get an amputation. Then how do I clean my feet? First of all, never dip your feet in water. If you are a diabetic, we are talking about. So never dip your feet in water for like very long time. We must check the heat, temperature of the water with hand before you dip it, because of the neuropathy, you may not feel the temperature and you may just get a blister on your leg. And we see these patients every second day. We must dry in between the toes. So after bath, we take a dry towel, dry it up in between the toes, otherwise you'll get a fungal infection over there. Normal people, they will not get it, but in diabetics you can get. And once you get a small fungal infection, you can get a bacterial infection in that, and you can get a cellulitis. Apply the cream on the foot like this, moisturizing lotion so they do not dry. And cutting nails is very important. You should always cut the nails straight on, because always try that you don't injure your skin by the side of the nail by the nail cutter. Even a small wound by the nail cutter can cause you a cellulitis and cause you an infection. So properly straight cutting, and then use the filer so that it is not sharp. So do not cut the nails like this. This is not right. And a small wound which you can see here can be very bad. Second is never walk barefoot. Okay. And if you're wearing shoes without socks, you never should wear the shoes. And third is, when you want to buy the new shoes, always buy it in the afternoon. Because if you're going to buy it in the morning, it will be thin. All the diabetic patients will get some swelling by the end of the day. And if you buy in the end of the day, the foot will be more swollen. So you want the shoe which is neither too tight and neither too loose. So you should try to get it done in the afternoon. So I'll stop here with all the preventive techniques, and then we can take up some questions if required.
Thank you, Dr. Saab. Thank you. Such a deep insight which you have given to us. Oh my God. Oh my God. It's an eye-opening, Dr. Saab. It's an eye-opening. There are certain things which you have given which we have never thought of, which we have never realized in our life. Today, when you have told that buying shoes in the afternoon, oh my God. And then we take bath. Generally, we are very casual. We dry up the whole body, but we never put the towel or something or a cloth in between the fingers and just try and see it over there.
Yes,
Now,
but the diabetics is very important. Normal people, all these things, they don't apply. you know.
Okay, okay, okay. And Dr. Saab, if I'm not becoming too personal,
No, please,
but
please.
I would like to endorse in public, right on this platform, with lots of responsibility, that my entire family owes a lot to you. Owes a lot to you.
Thank you.
My younger brother, somewhere around 28th of April, he caught into the second wave of Corona. And thereafter, once he recovered from the Corona, and he had developed, kind of a problem in his leg for the blood flow, vascular. And thereafter, when we got all the examinations done, and when you showed me all the, the x-rays and everything, and you had shown me that there was no blood flow at all.
Yeah.
And there was altogether of a different color.
Yeah.
My mother sends you blessings this evening. She's about 90 years old.
Oh, thank you.
Excuse me. And she sends you her blessings. You saved the foot of my brother. You saved the leg of my brother. If one is that you just have a hearsay, and one is that you face in your family, and what you have done for my brother and for my family, because you gave a personal treatment, you took care of him so well, and you were so concerned, and your entire team in the Fortis hospital in Mohali. I owe my life to all of you.
Oh, no,
You
please,
all have
thank
done
you.
a commendable job, Doctor. And please do tell us, there may be many border cases as well. Let me just check up on some questions also, because I think I should not deprive the universe from this evening, and only I take a benefit of it. Let me just check up over here. The people, those are joining us from world over, let me just check up in case if somebody has got some questions, and if they would like to. The people, those are joining over here, you have got the entire tourism fraternity, those are joining. And there's a gentleman called Mr. Subhash Verma. He's a former president of Indian Association of Domestic Tour Operators. And he had also been the Secretary General to the consortium of the entire tourism hospitality industry of India. He is telling, when we are promoting medical tourism in India, and when we are not, I should not use the word promoting, when we are, when we are giving a proper kind of a treatment in India for medical tourism, how do you look at basically the vascular, and particularly for diabetes and other areas? Are we getting enough patients from the world over, or how basically to go by where tourism can be linked with diabetes prevention? That is the question he has got.
No, sure. You see, I was trained in UK, and we used to get a huge number of people with a diabetic foot and a peripheral vascular disease patients as a medical tourism, what we call the word as, from all across the world, and from Middle East, and a lot of VIPs we used to get. Now, when I never actually concentrated sitting here on the medical tourism. The reason for that is because I actually concentrated on educating the local public, and because at present we are catering like 4 states, and if I look into the 4 states, the amount of population what we have, and the amount of diabetes what we have is so huge that actually we never got time to promote outside, because we don't have enough people to promote it as a tourism abroad. We are so less that we are not able to promote it actually into the, there are nearly 22 states where there is no diabetic foot treatment at all in the country. So we are actually not able to cater outside. We are not able to cater India also. Coming to your question is, yes, if somebody look into it, India in terms of vascular surgery and a diabetic foot treatment is actually on a very good scale if you look into the technical part or into the medical part. And if some company wants to promote it across, across the whole Middle East, look into Bangladesh, Bhutan, all the Russian, peri-Russian countries. And if you look into all of Middle East countries, there is a very few people who are actually specializes in this field. So, and if you look into the whole of Africa, there is hardly any people who actually specializes in diabetic foot. So there is a huge vacant field, and a vacant field, I'll tell you. So if any doctor is there, who wants to take up, some branch, and so this is a huge field, and we don't have specialists who caters a diabetic foot, and so that's your answer.
Thank you, Doctor. Thank you. Very kind of you. There is another question coming from Central Asia.
Mm-hmm.
Diabetes, what are the major symptoms and what is the stage when the foot gets diseased due to diabetes?
You see, the first question is, what are the symptoms of diabetes? So this is anybody, sudden onset, sudden change in behavior is if they start feeling too hungry, if they start passing urine too often, and if they start feeling too thirsty, and unexplained weight loss. So these are the 4 symptoms. If any patient gets, so they must immediately go to the hospital and get their blood sugar checkup. Okay, this is what. Second is coming to the diabetic foot. So any patient who has got more than 10 years of diabetes can have a diabetic neuropathy, depending upon how good the control of the diabetes was there in the last 10 years. So once you get a diabetic neuropathy, means your nerves gets affected. So along with that, in 10% of the patients, your blood vessels will also start getting blocked. And then a small wound on the foot can either arise by itself, or you can get it by trauma, just a shoe bite or hitting on the table, or a small, injury while cutting the nails. And that can result in a rapid infection spread all across the foot. And when you get a diabetic foot.
Okay, thank you, Doctor. Thank you, very kind of you. There's another question coming up, Doctor. How do diabetes or diabetic cope with stress?
Of course, you see, any stress to anybody, that leads to the release of corticosteroids in our body, steroids. And the purpose of steroids is to keep the sugar levels high. So if you are stressed continuously, then your steroid levels will be high, hormonal levels, and that will result in high sugar levels, and that can result in uncontrol of sugar. So that's why stress is one very important part. So you could have do a yoga by which you can get the hormones down, and you can help in decreasing the amount of medicines what you require in diabetes.
Thank you, Doctor. Thank you. Do blueberries raise blood sugar in diabetes?
Blueberries?
Somebody has written blueberries. I think basically fruits की बात कर रहे हैं.
Yeah. You see, you have to understand all fruits have sugar. Okay, and that's why the animals, they eat it. So all fruits will have sugar. So it being a berries or being anything. So question should be, can the diabetic people eat blueberries? Yes, of course they can eat. Okay. But it has to be on a quantity. It has to be measured in a small quantity, and in a sort of a, not like you are eating the full bowl of blueberries every day, and you have to monitor your sugar levels. And also you need to see all the diabetics should get a diabetic chart, food chart, in which what we tell them that one banana of this weight will have so much calories. One chapati of this much size will have this much calories. So one tea with this, if you make milk and sugar, this much calories. So actually talking, all diabetics should learn by heart that charts, because all the diabetics, we restrict them according to the weight, that 1600 to 1800 kilocalories they need to eat per day. So let's say if you are eating blueberries and you cover 250 calories in that, and then rest of the food you need to manage accordingly. So that it's not about one fruit or this thing you cannot eat or this thing. It's about the total calorie intake per day, which needs to be concentrated. So people call us, can I eat banana? Can I eat apple? Can I do this? I said, please, you can eat anything you want, but you need to look into the calories, what total calories in a day you are eating. If you are eating something here, then you need to compromise on the other thing.
Okay. Thank you, Dr. Shab. There's a head of the educators forum of the entire Northeast region,
Okay.
Mr. Tyrone D. Brass, and he is asking a question. Sometimes when you're too conscious, what to eat, what not to eat, what time to eat, but if you're mentally strong and if you're mentally positive and thinking positive, do you think, does it help to overcome your disease or diabetes and other kind of things?
Of course, this is a very important thing. And that's why, yoga is becoming such a big thing all across the world, because that basically teaches you discipline. That's what it is. And diabetes, actually talking, requires a huge amount of discipline. And so what you're talking about is the same thing, that if you do any of such things, and you will be able to control your urge of eating food and urge of eating sweet food, actually, and absolutely, I agree with you.
Thank you, Dr. Shab. Small couplet for you. It is coming from my younger brother, just to pay his respects to you, regards to you.
Thank you.
And gratitudes to you. He says, मुझसे मरीज के लिए जिंदा सबूत हो, मुझसे मरीज के लिए जिंदा सबूत हो, हाथों में आपके शिफा, डॉक्टर जिंदल, आप ईश्वर के दूत हो.
Oh, thank you.
That's coming all the way from your brother. And now another question I'll take on. Can I take few more questions?
Yes, please. Yes.
Okay. There's another question coming, Dr. Shab. Why India is considered as a diabetic capital, and what is the basic reason behind it? I think by and large you have told our eating habits and all that, but still, please amplify that a little bit more.
You see, diabetic is a bit of genetics, definitely. And we are learning more and more, and we feel, but it's basically two things: bad habits of eating and lack of exercise. And I see here around in Punjab, Haryana and all, hardly people do exercise at all. And people eat a lot. So,
Oh God.
Two very important things.
Obesity. Oh my God. And you have mentioned very important thing for people, that cigarettes, that is smoking. And you have also told alcohol. Also you made a mention. That also you have made a very big mention. Somebody is writing, should I check my blood sugar levels at home with a glucose monitor? How often should I check if it is required?
No. If you are not diabetic, then you don't need to require to monitor. Absolutely not. Okay. Because the body itself checks it up. But if you are diabetic, then yes, definitely. Depending upon your sugar control. If your sugar is well controlled, then you can check it up every week. And if your sugars are not controlled, then you need to check it up. That your doctor will let you know how frequently, how often, and all those other things.
Okay, great. Doctor, what would you like to tell the youth? Because today the lifestyle, today the eating habits, today our social media, everything what we are taking into consideration, and particularly what message would you like to give for teachers? And what would you like to tell children? Let's take both separately. First, in education ecosystem, teachers, what do you include so that we can avoid becoming a world global diabetic capital? And secondly, to the youth, what message you would like to give? Because where they enjoy the life also, but at the same time, they do not come into the trap of this, Doctor.
Yeah, I'll start with the youth because that will cover the children also,
Okay.
What, my kid was in school. So I used to go their sports day. I'll give you this example, will really suit you. And within 5 years, I could observe the obesity rate in the children going from 10 to 15% to 40%. My elder son, he did a study in when he was in 9th and 10th, and he compared. First, he calculated how many kids are overweight and obese, in the class. So that was coming out to be 35 to 40% in the most affluent school in the city, which is really bad. Okay, and it should not be more than 2%. Okay. Second is because childhood obesity is directly linked to the diabetes. So if you are obese in your childhood, then the chances of you getting a diabetes at the age of 30 years is very high. Next is when he did a study, he compared the government schools and the private schools, and they found that it is similar. So we thought that the government schools will have people from the lower socioeconomic status, and those kids will be much thinner. That was a theory, but it was not true. So what the most important thing is the food habits, because most of the people now are getting into the fast food culture. Burgers, pizzas, whatever is required, eating outside, which is there. You have to understand our basic Indian food, which is there, which we cook at home, is brilliant. And that's the best food in the world, if you look into it, really. And if you look into the food charts, which are displayed all over the Europe in the diabetic clinic, and they go into the category 1 food chart, which is the best food to eat, 80% of that food is an Indian food. Okay, I'm not talking about butter chicken, okay, Indian food, okay. I'm talking about cooked normal Indian food I'm talking about, okay. So this is very important that I personally feel that food intake is, and what are the type of food which we eat is very important. Message to the teachers will be that I feel that they should make sure that every kid in the class is included in the sports. And I'm not talking about the sports like chess. I'm talking about the sports. Of course, chess also burns a lot of calories. It has been shown. But I'm talking about the sports which requires an active movement. And they make sure that every kid in the class is involved. And if they find that any particular kid is overweight or more weight than the normal kid, they should be put in an extra 2 classes of an exercises in the curriculum only. They should also speak to the parents and guide them that there is something in the diet which the kids are not having properly at home and which could be changed. Because you will see most of the time the whole family is obese or overweight, because it's the type of food the whole family eats together which causes you these issues.
Wonderful. Wonderful. What a way you have given the whole ecosystem of the education, teachers, youth, and everybody. There's another question coming. On festivals, we eat a lot of sweets. So how to balance that in the subsequent days to avoid increase in sugar level?
You should eat sensibly during the festivals. And of course, you should eat sweets. I'm not against it. But if you are eating a lot of sweets, then don't eat a lot of chapatis, then because you can cut down the calories from the carbohydrates on one go, and you can eat vegetables and eat sweet. And because how I manage is, if I go to some party and if I make up a mind that I need to eat a dessert today, so I actually omit all snacks, all meals. I just directly go to the dessert counter. And so by which you can balance. You cannot have then you can have a 1 hour of snacks and then 1 hour of food and then another 1 hour of dessert.
Okay, thank you, Dr. Saab. Another question: what are the side effects of the medication or insulin or other things? Because there are lots of people, those are having other disease and they're taking a regular medication and they are on to regular things. So
you see, I'll put it in one line.
Yeah.
All medicines have side effects. But if you have been prescribed medicines for the diabetics, they being oral diabetic drug or an insulin, you must take it, because the benefits of these drugs really outweigh the drawbacks in any way. So there is no point getting in all the side effects, because the benefits will be much more. So, and that is one, but along with a diet control and exercise.
Thank you, Dr. Saab. Thank you. Dr. Saab, our chamber would like to join hands with you. As you mentioned, very alarming situation that when we talk about the diabetic foot treatment, there are only approximately 1,000 doctors for such a huge population.
Yeah.
Now, there is a new education policy 2020, which has come on 29th of July last year. And the Honorable Prime Minister is very keen that India should become the skill capital of the world in future.
Yeah.
So now, how do we go by? Because you have given a very alarming situation for India, but more alarming for Africa also.
Yeah.
So when we talk about services exports, when we talk about teachers exports, the counselor exports, technocrats exports and all that, do you feel our ecosystem can be developed like we teach Indian history, other things through the NCERT books in our schools, colleges, universities, institutions, polytechnics, ITIs? Do you feel that particularly awareness about diabetics with you, how can we make it a global campaign so that first in India, like Swachh Bharat was introduced by the Honorable Prime Minister.
Yeah.
And when you are giving such an alarming situation to the country, I think at this point of time, how Fortis, how you as an individual, how you being associated so deeply with the UK, being trained and expertise and all that, how we can help the Indian youth and education ecosystem. Particularly, can we work out a strategy? Maybe I will take on separately with you once in a month with the global teachers, with all the Indian teachers, educators, once in a month, half an hour with you. And let's take the agenda of the Honorable Prime Minister of India, Shri Narendra Modi ji, that if India has to become a skill capital of the world, first our health has to be in order.
Absolutely.
We got to be taking. So would you be kind enough to spare about half an hour once in a month?
No problem
just
at all.
To be with us?
This is very, very important. And in short, you have to understand diabetes will be the #1 killer in our country. And we don't have a data, but it must be the #1 killer in our country anyway, now also. And it is one of the most common cause for kidney failure and the dialysis centers and a kidney transplant, and we lost 2 ministers very recently, as you know, who had a kidney transplants and all, and they're all absolutely all related to diabetes. Okay, so I feel the first important thing is we should have every kid in every class should be talk about the diabetes. So it should be into an education program, first of all.
Okay.
By which we just actually will, because that effect will take 20 years to come. Second is we should teach the teachers, because they are the backbone. So this is the building. So this is the neem rakhna bolte hain na, kyunki aap agar neem strong nahi karoge to baki sab bahut mushkil hai. So teaching a 50 years old guy who's already obese and he's got some habits, usko change karna, I have been trying from last 25 years. वो सबसे मुश्किल काम है, वो बहुत मुश्किल है. It's not that we should not try, but that changing that is very difficult. And I think the only thing we should do it now at present, जो हमारी जितनी हमारे पास resources हैं, we should concentrate on the schools. And if we are able to concentrate on all the teachers and the schools, we will win. The colleges, of course, will win the battle.
Thank you, Dr. Saab. Thank you. You have given very, very valuable inputs to all of us. And when you mentioned about yoga, something is very interesting coming to my mind, Dr. Saab. There is a separate ministry being created by Honorable Prime Minister besides education. Ministry of Skill Development and Entrepreneurship. Ministry of Skill Development and Entrepreneurship, Government of India. They have got 37 sector skill councils. And one of these sector skill council is a wellness sector skill council. I am going to bring the CEO of that sector skill council, which is across India, the yoga, the meditation, the naturopathy, and everything being taken care of, including meditation and prevention. I think with you, with the CEO of the Sector Scale Council, Madam Monica Bahal, if we do one program, the message will go deeper, louder, clearer, and we have to work very closely with the Sector Scale Council. And with the commitment from you that you would be kind enough to spare half an hour once in a month for at least 10,000 teachers together on a common platform with the Sector Scale Council.
Well, I'll be very happy to do that. No problem.
Thank you, Dr. Thank you. Final message for the humanity from your side before we close today's session. While I convey my deep gratitude and thanks to you for having spared your time. You were busy in the operation theater, but still you had come for the program. Please.
I'll say final message is, like, being in the diabetic is, I think, put it across in one line. I think prevention is better than cure. There's nothing, I can put it in one line, everything together.
Thank you, Dr. Thank you, Dr. Ladies and gentlemen, I, in personal capacity as an individual, as a human being of 72 years of age, I put my gratitude, my thanks, my heartfelt, I run short of words to convey my thanks. He saved my brother. He saved his life. He saved his foot during the post-pandemic, particular era when I'm talking to all of you, second wave, my brother suffered, deeply. And I went to Dr. Saab. He was very, very kind and he saved him. So I can vouch for it. What he's saying is universally acceptable. And Monica Bahal ma'am, as a CEO of the Sector Scale Council for Wellness, I invite you, and along with Dr. RAVUL Jindal, the eminent vascular surgeon at the Fortis Hospital in the beautiful state of Punjab in India, we request him to spare half an hour, and all the educators, teachers, our CBSE, our Navodaya Vidyalaya, our Kendriya Vidyalaya, our army schools, all of us, let's take care of children. Let's take care of everybody. No obesity, no smoking, no drinking, and healthy food. We all got to live longer, because now with such a beautiful medical facilities, everybody should live for 100 years at least on this planet without any kind of a disease. And Dr. Saab should meet us in some party, not in the operation theater.
Oh, no,
Thank you, sir.